back to the big picture. It is 9:41 on your Thursday. I wish we were talking about a more pleasant topic, but this topic is going around. So is the bacterial virus. See what I did there?
Yeah.
I'm so punny. We're talking about Cyclospora.
Yes.
Yeah,
It's a
I wish
parasitic
it was
illness.
a better name too, but basically it causes horrible diarrhea and it could cause dehydration and lead to a lot of other problems. But right now there's 500 cases confirmed in Ohio, according to the health department, and about 300 of them are in Lucas County right now, which is near Toledo.
Okay.
So kind of interesting how it's concentrated in that area.
Yeah.
But I have a lot of questions about this because, you hear different things online, but we want to go right to the source and talk to doctors about it. So joining us right now, we have Dr. Chris Johnson. He's a family med physician with OhioHealth. Chris, thank you so much for joining us today.
Definitely. Thanks for having me on.
Okay, so we're talking about this bacterial virus. It can cause a lot of diarrhea. Have you had patients come in getting diagnosed with this?
Yeah, we have had quite a few patients with this illness, and it's actually a parasite, which is a little bit different than the viral and bacterial illnesses that usually cause diarrhea. So this is needs a human host, or it needs a host, and it happens to be humans, and definitely it's hitting people hard with extensive diarrhea.
And when we look at it, because we look at this one, a lot of the symptoms are similar to norovirus. And when we look at how things are transmitted, what are the differences here between this cyclospora and norovirus?
Yeah, that's a great question because we're used to the typical viruses like norovirus, and norovirus is a horrible diarrheal illness too. Um, One of the differences with this is the duration of time it lasts. So a lot of the viral diarrhea causing organisms last less duration than this. If you end up with cyclosporiasis, a lot of the people get diarrhea for, I mean, it can last even months. And what we've been seeing is that the typical presentation, people present with diarrhea that they had fevers, chills, abdominal cramping, diarrhea in the beginning. Then they get a little bit better, and then the diarrhea comes back. So we've been seeing oftentimes the second kind of wave of it, which is very typical of this parasite.
Now, this is a question from one of our producers, Maddie. Can pets get this?
That's a great question. It's definitely been linked mostly to primates, and obviously, humans are the ones that we're actually culturing, or it's not truly a culture, but testing microscopically to see if they have this. It's also different from norovirus, and this kind of goes to the pet question. It's not really thought to spread human to human. So not, norovirus, you get somebody on a cruise ship and there's 80 people that end up leaving the cruise ship with norovirus. This isn't thought to spread human to human. And so we don't think it's something that pets really have a high risk of. It seems to be more of fortunately or unfortunately, a human parasite.
And when it comes to the treatment of this, is there really a treatment, or is it more about just managing the symptoms for the duration?
Yeah, but both of those are options. It is something that you can clear on your own. So if you have mild disease or mild amount of diarrhea, you can try to hydrate and take the antidiarrheal medicines. But most people would benefit from treating it with an antibiotic. It definitely lessens the likelihood of it lasting for 2 to 4 weeks. The number of people that are treated that still have disease or have the parasite in their stool after taking the antibiotic is much less than the people who just do supportive care.
And what can people do right now to protect themselves and avoid contracting this?
Yeah, I mean, I think that's what we always preach for any infection is what can we do to try to prevent it. It's this one's a little bit tricky because it's spread so much, and they haven't been able to isolate what the cause is. It's usually foodborne, and usually from fruits or vegetables that are imported. It's from warm tropical climates, so it's not something that usually starts in the United States. So it's usually transported in via food products, but they haven't been able to isolate that yet. So, I mean, the standard things, good hand washing, wash your fruits and vegetables, peel them if you can, buy things that are easy to wash. The common transporters are like leafy things, cilantro, basil, lettuce. And another one that's always thought of is berries because all the crevices that parasites can hide in. So always wash them. The unfortunate part is you can't always wash parasites off your fruits and vegetables. So, I mean, you certainly can be extremely diligent and still end up with this parasite.
And you mentioned it a little bit too, and we know that managing norovirus it's important to stay on top of that hydration because you're getting rid of a lot of your body's water content in the process of the symptoms. How important is it to stay on top of hydration and making sure that you're eating and keeping water down?
Yeah, you nailed it. So the good thing with, if there is a good thing with Cyclospora, is that it is not usually life threatening. It's not usually a critical illness. It just causes people to be really miserable. When they get in trouble is when they end up dehydrated, malnourished, and that's what you were getting at. So we can prevent that. We can try to protect that by really pushing fluids. If you have a lot of diarrhea, your electrolytes can get out of kilter. So having Gatorade, Powerade, electrolyte supplements, liquid IV, any of those are helpful. And definitely trying to just push fluids more than even nutrition, as you need to keep your fluid balance up. You can even get dehydrated enough to end up with kidney issues. So I mean, most important thing anyone that has this can be, other than seeking treatment, is just purely hydrate.
So is it bad for people to maybe take like an anti-diarrheal? Like, should they try to get it out of their system if they think they have this? When should they call a doctor as
Uh,
well?
Yeah, both are good questions. So some illnesses that cause diarrhea, we really don't want people to take anti-diarrheal medicines because you want to flush it out. This one is probably a little bit safer if you do try to slow down the amount of diarrhea, especially if you're trying to go to work or function. Um, so I think it's okay to do that. In an outbreak like this, I think it's reasonable to seek care if you have diarrhea that lasts even 3 or 4 days. The interesting thing is the numbers, like we were talking about, 500 people in Ohio. I mean, there's thousands and thousands, probably 10,000 people in Ohio. If my little office has seen 10 to 20 people, then you know that the number of people all across Ohio is high. The thing is, we don't test everybody. If you have the classic story, you can treat people without testing. So I think the prevalence of this is higher than what the numbers are even showing, which I guess is a little bit concerning. So seek medical care. Number one, if you're somebody who has significant illness, so if you have cancer, you're immunocompromised in any way, and definitely if the diarrhea lasts for 3 to 5 days, or certainly past that, you need to seek medical care.
All right, Dr. Chris Johnson, thank you so much. Is there any final piece of information you think our viewers need to know today about this?
I think you guys really nailed it with the questions. The most important thing is hydrate, and if you're not getting better over a short course of time, to seek medical care.
All right, Dr. Johnson, thank you so much for coming on. Enjoy the rest of your day.